At Hewitt, we consult with large employers, helping them improve employee health and reduce absence through better program design. In addition, we are the leading provider of benefits outsourcing services, administering health and welfare benefit programs for 195 employers representing nearly 8 million participants. I'm pleased to focus my remarks today, as requested, on the experience of large employers, the majority of whom do provide health care coverage today. While large employers are not a homogeneous group, I do want to be clear in saying that employers and Hewitt support the concept of health care reform and believe that all efforts to cover working Americans should build upon and further strengthen the employer-based system which provides coverage to more than 160 million participants today. Employers have a vested interest in the health and productivity of their workforce, and the employer-based system has helped foster that interest. However, despite the positive actions of employers, there are many problems to solve in the current U.S. healthcare system. As we all know, healthcare is too costly. Average annual healthcare costs for a typical large employer will exceed $13,000 per employee by 2014, a 50% increase over current costs. Both employers and employees will find it difficult to afford such an increase. We also believe that systemic changes are needed to reverse current cost acceleration. The federal government, employers, and health plans must work together to change the payment system to better focus physicians and hospitals on wellness, primary, and preventative care, with strong incentives for evidence-based medical treatment. Finally, we spend too much on chronic conditions without measurable quality. We must attack the root causes of smoking, poor nutrition, obesity, and physical inactivity by providing financial incentives for healthy behaviors. This will not only lower healthcare costs, but will also reduce absence. This is critical, as lost workforce productivity is a very real cost to the U.S. economy. The cost of healthcare for large employers and their employees is higher because of gaps in coverage and differences in reimbursement rates between public and private healthcare programs. Large employers pay somewhat higher premiums to cover provider costs for uncompensated care. Further, employers fund higher costs for medical treatments because Medicare and Medicaid payment rates are comparatively lower than rates for employer-sponsored group health plans. Large employers are concerned that cost shifting could increase further if rising healthcare costs encourage small and medium-sized businesses to drop health coverage in order to remain competitive, particularly in these difficult economic times. So how do we address these issues? In our written testimony, we identified 5 imperatives for healthcare reform, and I'd like to highlight 3 of them today. First is we need to preserve and promote the employer-based healthcare system that generally works, while imperfect, for 160 million people today. Second, we must protect and strengthen federal ERISA preemption of state laws to promote uniformity in coverage and reduce administrative costs. The vast majority of large employers operate across multiple states, and they must be able to continue to offer administratively efficient, uniform benefit packages to their employees. And third, we must allow employers flexibility in how they meet any new standards for health coverage. For example, they should be able to demonstrate that their plans are equivalent in value to any standard benefit requirements, similar to the rules in place for the retiree drug subsidy under Medicare Part D today. As I noted at the outset, large employers support health care reform that will lead to sustained affordability for themselves and their employees. How large employers react to specific reform proposals will depend in large part on the many critical details in any proposed reform, and whether or not large employers view that specific reform as likely to increase versus mitigate their health care costs. The earlier that Congress can make details available for discussion and analysis, the better that employers can react. Congress has the challenge of sorting through the details of how reform will be accomplished, with competing approaches and viewpoints. Hewitt would be pleased to offer its data analysis and its experience in helping the subcommittee evaluate the impact of detailed reform plans on coverage provided by large employers today and in the future. Thank you.